Hello, it's Dr. Rhonda Johnson. Today is Tuesday, October 17th, 2022, and today I'm discussing the Florida Surgeon General's recent report. Well, you may have heard that on October 7th, the Surgeon General of the state of Florida's office issued a report titled Guidance for the Messenger RNA COVID-19 Vaccines. And in this report, the Florida Department of Health conducted an analysis that studied mortality risk after messenger RNA COVID-19 vaccination. That's basically Pfizer and Moderna. Now, their analysis found that there's an 84% increase in the relative incidence of cardiac-related death among men between the ages of 18 and 39 within 28 days following messenger RNA vaccine. And the Florida State Surgeon General now recommends against the COVID-19 messenger RNA vaccines for males ages 18 to 39 years of age. Well, numerous well-credentialed scientists and experts have commented on this report and have said the analysis was very flawed. And I will summarize the findings of scientists who have reviewed this analysis. Number one, they say that the Florida Surgeon General's report draws conclusions from only a total of 20 cardiac-related deaths in men 18 to 39 that occurred within 4 weeks of vaccination. The authors did not review the medical records to confirm the diagnoses, and that's a major flaw. 3, there are no authors listed on the study. And folks, in my opinion, if you can't put your name behind a report that you've generated, that's not good. Number 4, they looked at death certificates, and any death that had an ICD-10 code under other forms of heart disease was included. Now, ICD-10 codes are billing codes. They're used for payment. They should not be used without verification in a study like this. Now, number 6, the authors note these significant limitations, stating that they cannot determine the causative nature of a participant's death. And you're alleging that the vaccines are causing the death, and then you say you can't determine the cause of death? And the underlying cause of death may not be cardiac related. This is written in the study. That's a flaw. Now, one physician scientist that I follow has a blog that reviewed this analysis, and I'll include the link. And she says, finally, it should be noted that whenever you perform a risk assessment of vaccination, you have to compare the risk of the vaccine versus the disease it protects against. And this analysis didn't do that. There are lots of other commentaries, and most are highly critical. You can just search online. Many medical journal articles have reported the association between messenger RNA vaccines and myocarditis, and I have discussed this in the past. It is true. There's no denying that the risk is real, but the risk is considered small compared to the risk of COVID. Now, again, the risk of myocarditis from COVID is real. The risk of cardiac death and disease following COVID infection is real, and the risk of long COVID is real. And it affects some people disproportionately, such as Black and Hispanic men, who are at the highest risk for COVID infection and death in the prime of their lives. The bottom line, in my opinion, is please consult your doctor to evaluate your risk, not this Florida Surgeon General's recommendation. That's my opinion today. And as always, I hope you will be aware of misinformation and always consult your physician. A vaccine is a medical decision, and it should not be taken lightly. Take care, folks.